Hello, and welcome to Bariatric Care, the podcast, or Bariatric Care Live. However, you are watching or listening, I welcome you. I'm Dr. Connie Stapleton, and today I'm going to be talking about something related to what we've been talking about the last couple of weeks, only taking a little step further. We've been talking about habits, how to build good habits, how to let go of unhealthy habits. And last week we talked specifically about emotional eating. Now, emotional eating can definitely be considered an unhealthy habit if what you're looking for is to live at a healthy weight, improve your health, live at, a healthy lifestyle, one that allows you to do the kinds of things that you want to do, have the kind of quality of life that you want to have. So we all know that a healthier weight leads to being able to do things more easily, right? Having extra weight doesn't necessarily prevent you from doing all kinds of great things in the world. But once that weight gets to a certain point, it oftentimes interferes with health and our ability to do some things that we want to do. So we're looking for a healthy lifestyle here. We're looking for an improvement in how you feel about yourself. And when we engage in unhealthy habits, we don't feel as good about ourselves as we might if we're engaging in healthy habits. So we're going to go with let's become the best me I can be so I can live the best life that I can have. Today, we're going to take that emotional eating one step further and talk about where does emotional eating cross the line into food addiction. So the topic for today and Thursday is food addiction. Now, this is a controversial topic, both with the professional community and with the lay community. So, wherever you stand on the issue is fine, not a big deal. I don't care where you stand on it, and I'll tell you why in just a few minutes, all right? But I want to start today's talk with a story, and I call this story The Surgeon and the Psychologist Square Off. This is a real life story, and I am one of the leading characters in the story, and a bariatric surgeon is one of the other leading characters in the story. In fact, there's pretty much only two characters in this story. So several years ago now, it's probably been 8 or 10 years, I don't know. I was at a conference. It was a patient conference, and it's a very professionally done, really a great, great conference, probably one of the best I've ever been to. And at this conference, and the conference is not just for persons who have opted for weight loss surgery. It's for anyone who's struggling with weight issues and how to deal with those. So I'm at this conference and I'm on a panel discussion, and I think the topic was like motivation or something, but what it was not, the topic was not about food addiction. But I was talking to the surgeon about food addiction while we were waiting for the conference or for our talk to start. And it was just he and I sitting up in front of the room at the panel table. And I hadn't met him in person before, but I had heard him on a podcast. And the podcast, I really encourage you to listen to this podcast, which is called the Weight Loss Surgery Podcast. And it is hosted by Rieger Cortell, who is a nurse practitioner who lives in the state of Oregon. And she is an ultimate professional, and her podcast is second to none. She interviews patients and professionals, and she allows her curiosity to kind of take her where she wants to go in terms of who she wants to interview. Well, she did a two-part interview with this bariatric surgeon, and I was absolutely fascinated by the conversation that they were having. And he was talking about so many of the things that I resonate with in terms of the surgery is so much more than just a surgery. It's about a person. It's about the whole person, their body, their mind, their being, their essence, their spirit, however you want to refer to that. And it's about their lifestyle. And more than that, it's about the relationship they have with themselves, the relationship they have with food, and the relationship they have with other people. So I was really, really enjoying what he had to say. And in the second part of the podcast, the second part of the two series, he was talking about food addiction. And Rieger was asking him about food addiction. And what he said shocked me because it was so contrary to all of the things he had been talking about. And what he basically said was that addiction is not a real thing, not just food addiction, but any addiction. Well, that made me cringe because I've spent my entire life working in the field of addiction and recovery. So that was jarring to me. And so when I met him, I said, I listened to your podcast series with Rieger and it was so amazing. And I really enjoyed it. And I like your take on all of these things. And I was so excited. I said, I was a little confused by your perspective about addiction and food addiction in particular. And he said, addiction is not a thing. And I thought, I wonder how many of the patients that we work with believe that addiction is a thing and that food addiction in particular is a thing. And so I shared my opinions with him that, in my experience, that working with patients, a lot of them would share with me they believe they're a food addict, and about the work that I've done, the research I've read, blah, blah, blah. And actually, he was quite insulting. And I was very taken aback by that. And so again, this topic that we were speaking on was not about food addiction. He was the first speaker and he got up and addressed the audience. And he asked the audience, how many of you in the room believe that you're a food addict? And nearly every patient hand in that audience went up. And the audience was like 90% patients. So I think that may have shocked him a little bit. So we went on and did our presentation, which was not at all about food addiction, but I think it was critical information for the surgeon to see that so many patients do consider themselves to be food addicts. Now, I'm going to talk today about what the science says just a little bit because it kind of bores me actually about food addiction. But more than that, I want to talk to you about the continuum between emotional eating and kind of share my thoughts and ask you to consider your own thoughts about where eating falls on a continuum of the addiction spectrum, right? I believe food addiction runs the gamut between emotional eating to biological one bite of sugar and I'm gone. I do not believe everybody who has a weight issue, whether it be too thin or too heavy, is a food addict. Absolutely not. And it may surprise you to hear me even mention people who may be underweight as possibly having a food addiction. Well, some of you are familiar with the work of Dr. Vera Tarman, and Dr. Tarman is a medical physician who is in Canada. She wrote an amazing book called Food Junkies. And I would really encourage you all to listen to Food Junkies or read Food Junkies, especially the second edition, because in the second edition, she actually talks about weight loss surgery and food addiction. She and I have had several very good discussions in which she can explain to myself, and I've seen her explain to patients in a very non-medical way about the physiology, what happens to the body when food addiction is present, and what happens particularly in the brain when food addiction is present. Now, I would really encourage you to read that book, but I would also encourage you to continue to think of food addiction on a continuum. Now, let's talk just for a minute about the definition of addiction. And there are a lot of definitions floating out there in the community. And I don't know that there's one that is the definition, but I'll tell you something that makes a whole lot of sense to me. And again, remember, I've worked in the addiction and recovery field for over 25 years. And the thing that makes the most sense to me about addiction is thinking about addiction in terms of knowing there's a problem, right? People who have an alcohol problem or a drug problem or an issue with food. Even though denial is a huge part of addiction, right? For a long, long time, people will say, I don't have a problem with that. I can stop anytime I want. But can they really? Can they really stop anytime they want? So I've had a lot of people that I work with alcohol or with alcoholism or alcohol dependency, however you want to call it, say I can stop anytime I want. And so what they do in terms of proving that is they'll stop for a short time. See, I can stop anytime I want. But they don't really stop. They just go on a little hiatus. And to me, that isn't really stopping if there are still problems associated with the use of the substance. So, a great definition of addiction in non professional terminology is if you know something's causing you a problem, and if you've had problems with your weight in terms of health issues, where the doctor has said, you've got to lose some weight, or your blood pressure is going to be so out of control and you're going to be at high, high risk for a heart attack or a stroke, or your cholesterol is dangerously high, or you're on the verge of developing full-blown diabetes, or you have really severe diabetes, and if you would lose weight, it would be better, or your mobility problems related to your weight are really getting severe, and I'm worried about your knees, or I'm worried about your hips, or I'm worried about, whatever health concerns you're having that are being made worse by your weight. Many, many people who get to the point of having weight loss surgery, not all, but many people who get to the point of having weight loss surgery have heard those words from their physician, or they have said to themselves or their significant others or their children or their loved ones, I know my weight is a problem and I know I need to change and get some of this weight off in order to live longer, to be able to be active with you. This is something I really, really want to do. And for a short time, they do it. How many of you have traveled the roller coaster of weight loss and regain? If that is you, there's a possibility, and dare I say a probability, that food addiction is a possibility for you. And the reason I say this is because if you've been to a point with your health, whether it's alcohol, whether it's recreational drug use, whether it is your weight, or maybe it's not even a substance, but it's a behavior like shopping, where you've gotten into financial trouble because of your spending, or gambling, where you've gotten so far in debt that it threatens your livelihood, or if you've lost a job because of any of these behaviors, or pornography or sexual behavior or promiscuity or whatever it is, if any of these behaviors have caused either physical health problems in your life or emotional or relational problems. So let's talk about what might that look like? What might a relational problem be in relation to drinking, substance use, any kind of drugs, shopping, gambling, food, weight, any of those things. What might be a relational problem? Well, if the people in your life say, I'm concerned about your drinking, I'm concerned that your job is at risk, or I'm concerned about our relationship because you spend so much time with the internet or social media or online pornography that there's not a lot of time left for me, or for our family, or you spend so much money shopping online that we're having a hard time making our mortgage payment, or you've lost so much money gambling that it's really causing me a lot of resentment towards you. That would be a relational problem or financial problems. So, in other words, if your use of food has led to weight problems that are interfering in your ability to interact with your family or your friends or to engage in activities you enjoy or used to enjoy, then that's a problem, right? Or any other substances or behaviors that lead to problems in your life, it's a problem, right? Some people might say it's an addiction. Some people might say it's just a problem, but it's on a continuum of being a problem. So some people would define an addiction as something that's causing you a problem in your life, whether it's food slash weight, whether it's alcohol slash drinking, recreational drugs, gambling, internet pornography, whatever it is. If it's causing problems in your life and you know it's a problem and you want to change it, you have a sincere desire to cut back, lose weight, not drink so much, set rules for yourself about your drinking, not spend so much money shopping. You know it's a problem, you want to change it, but you slip back into it. You slip back into it. You slip back into it and you continue to have problems. A lot of people would say that might define an addiction. I believe that's true. I believe an addiction is knowing there's a problem and that whatever it is, the food, the alcohol, the drugs, the gambling, makes those problems worse, and you want to quit, but you don't, then I'm guessing there may be some sort of emotional or physiological dependency going on. Now, notice I said emotional or physiological. So I believe that emotional eating might be on, now this is, I got to be careful with my words here. I'm going to say this, but I don't know if I mean it. It might be on the lesser end of the dependency or addiction scale. And the reason I say lesser end of that is, let's say that you are an emotional eater or you drink a little more when you're having some stress in your life. But when you're not having so much stress, you don't tend to eat emotionally and it's not causing as many problems, right? Or you drink less, or you only spend money when you're all stressed out, but you're not all stressed out a lot of the time. So maybe it's not as much of a problem. But emotional eaters, if you are a very often emotional eater, maybe that's more of a problem, right? And the more you emotionally eat, or the more you count on alcohol to take the edge off of your day, and the more frequently you do that, I think you're going further along a dangerous continuum of a dependency. So many of you know I'm a recovering alcoholic, I'm a recovering drug addict. For me, alcohol was never a thing that I had to have so that I didn't like shake in the morning. That was not it. So when I learned long ago about the continuum of alcohol dependency, I had an emotional dependency on alcohol. I thought if I didn't drink, nobody would want to talk to me. I thought if I didn't drink, I wouldn't have the courage to talk to other people. I was emotionally dependent on alcohol. Same with my prescription drug use. I thought if I had any anxiety, if I didn't have a prescription pain medication to take that all away, I couldn't function. I was never down in 16 pain pills in a day, or I was never taking a handful of Xanax, or I didn't have a physiological addiction to alcohol or drugs. I had an emotional dependency on it, but it was an addiction. I thought I needed those things. I didn't need them to feel normal physically, but I thought I needed it to get by. So there's kind of an imaginary continuum. Do I need this emotionally? Do I need this sugar emotionally because I'll feel better? Or do I need it because if I don't have the sugar, I'm going to feel like I'm going to go through withdrawals? Let's talk specifically about sugar for a minute because scientifically, the research has shown that sugar can be a very addictive substance in a physiological, your body can react to it in a very physiological way. And sometimes they refer to drugs or alcohol or sugar as hijacking your brain. That's a physical dependency, right? So a lot of people who have a sugar addiction know it because they have a change in their physiology when they eat sugar. People who have a sugar addiction, a lot of times will talk about things like, when I'm eating sugary foods or sweet foods, I find that my brain is kind of in a fog. I'm not thinking clearly. I'm not able to make as good of decisions, especially food wise. But if I quit using sugar altogether, over a little bit of time, a few days, a week, 2 weeks, my brain clears up and I'm much more easily able to make better food decisions. That Dr. Tarman would talk about as a food addiction, when your brain is kind of hijacked by the substance, whatever the substance is. Now, an emotional eater might say, well, my brain doesn't get hijacked. I don't get in a fog. I just think that, I've learned that when I'm lonely, if I eat, I don't feel as lonely. Maybe that's an emotional dependency in my book. Now, I don't know that Dr. Tarman would feel the same way I do about that. And I don't know that a lot of other medical or mental health professionals would think that. I know a lot of them do agree that there's a continuum and that an emotional dependency is a dependency. So if you have learned to associate food with, now I'm not so stressed or nervous or anxious, maybe you consider that an emotional eater, or maybe you consider that sort of an emotional dependency on food. I don't care. I don't care what people call it. I don't care if you are absolutely physiologically addicted to alcohol or a drug or sugar or that fatty, salty carb combination. It doesn't matter. Why? Because if it's a problem, it's a problem. If you have a problem staying away from the carbs, the simple processed carbs, which are, I believe, processed to be addictive to our bodies in some ways, or sugar, what difference does it make if you call it a problem and if you say I'm a food addict and raise your hand in a meeting, or if you don't? I don't care. As long as you know if there's a problem associated with your use of sugar, processed foods, a certain brand of cookie, it doesn't matter. If it's a problem and it causes problems in your life, then it's a problem. So call it an addiction, call it an emotional eater. I don't care what you call it. Recognize it as a problem and know that you have to do something about it. And the something you do about an emotional addiction or a problem food or a food addiction, it's not weight loss surgery that's going to fix it. I guarantee you that if you have an emotional dependency, a physiological dependency on food, a food category, a food group, or any other addictive behavior or substance, weight loss surgery is not going to treat it. Therefore, it's critical that you understand that if food is a problem in an emotional sense or a biological sense, you've got to treat it in a way that is in addition to having weight loss surgery. Hence the book I wrote called Weight Loss Surgery Does Not Treat Food Addiction. So there are, again, some schools of thought that are different about how you do treat addiction. And I will kind of share with you Dr. Tarman, who wrote Food Junkies, believes that abstinence is absolutely essential. And I don't disagree that abstinence is a good idea. It's a really good idea, especially if you have a brain that is altered by the use of sugar, by the use of alcohol, by the use of, well, mood altering chemicals alter our brains. But if you have no off switch when you use a substance, or if you have no off switch when you get started gambling or start online shopping or get involved in internet pornography or whatever it is that draws you into the point where it's hard for you to stop, then stopping is important. So does that mean if you have trouble with sugar that every single person has to give up sugar? I can't say. I can't know what's right for you. I can say you're going to have to experiment with this. And a lot of people end up believing they have to give up the substance completely. Does that mean maybe you have to give up all simple processed carbs? Maybe. Does it mean you have to give up all carbs like those in a sweet potato or, you know, other healthy vegetables? Or maybe not. Maybe not. What I say is you have to do what works for you, but you have to do something. If a certain food or a certain food group or a certain substance or behavior is getting you into trouble, right? So either way, when you treat addiction or emotional dependency, you have to find out, am I doing this because I have no off switch, in which case you might need to do abstinence. You need support. You need support from peers and professionals who understand this phenomenon, right? If you don't understand addiction, there's almost no way to understand it. Now, sometimes people with a food addiction can easily see the issue with alcohol. I've been in groups where people are like, well, why don't people just not drink? But they don't understand how people don't just not use sugar. And what I always hear is, well, you don't have to drink alcohol to live, but you have to eat to live. There's no doubt that that is a true statement. But let me tell you something. You don't have to eat processed carbs like chips and dessert cakes and frou-frou crap to live. You don't have to eat boxed macaroni and cheese to live. You don't have to eat, um, you know, bakery goods to live. There are so many foods available to us that you can live without those things. You just maybe have an emotional dependency on those and you don't want to live without those things. So to me, when people say you have to eat to live, I totally agree. I totally agree. But you don't need processed sugar to live. You don't need processed carbs to live. So if that's been your go-to response, just realize it doesn't hold much water. Yeah, you got to eat to live. And so maybe it is more difficult with food. And I will say, after 25 years of working in the field of addiction and recovery, food and sex addiction have been the two most difficult addictions I've worked with over time. Why? Because they're both physical needs. We are wired to eat. We are wired to have sex. When those things get askew and we're eating in unhealthy, what seems to be uncontrollable ways, or behaving sexually in unhealthy ways that cause you physical or psychological or relational problems, it's a problem. So they are very difficult ones to deal with in terms of dependency, but they can be dealt with. But you need a support group. You need people who understand it's hard for me to stop eating sugar. It's hard for me to stay away from these foods. If people don't have a problem with it, they go, I just don't get it. Just push away from the table. There's not a real good support group in that person, right? Find some people who do understand. Not that will pat you on the back and say, I know it's really hard. I'm sorry you struggle with this, but ones that'll say, it is hard, but what is it you want? Do you want to be away from this compulsion? Let's talk about the ways that food has scientifically been researched to be common, have things in common with other substances of addiction or of abuse, all right? So there is this hijacking of the brain theory, right? Where once you start, it's hard to stop. And once you stop, you lose some of the craving, you lose some of the compulsion. That's a good argument for being abstinent from whatever those foods or substances are for you. But other similarities between food, overeating, and substance use include that compulsion, right? It just feels like a compulsion in needing or wanting or desiring or craving these foods in spite of having those adverse consequences that we talked about, the health problems or the relationship problems or the social problems or giving up activity problems. Craving is another commonality between foods that cause people emotional dependencies or psychological dependencies or physical dependencies. This intense craving that you just can't get it out of your mind. But once you stop, some of that craving lessens, right? There's also a whole lot of denial. I can stop anytime I want. I've quit carbs for 6 months. Wow, I lost 80 pounds during those 6 months. And surprise, surprise, when I went back, because I didn't really quit or I couldn't really quit, I gained it all back. So there is some denial. God, somebody used a great word today and that I had it was di- denial or something like that. It was diabetes denial, right? Denying that they had diabetes because they didn't want to give up the lifestyle that created the diabetes. I was like, that is brilliant. So there's a preoccupation. Ooh, when can I get to, the fast food place? Or gosh, how long till work's over so I can get to the bar? Or when can I get to the deli? Or when can I get to the fast food? Or when are they bringing that treat cart around? There's guilt that follows excessive use, right? Somebody goes out on an alcohol bender and then they feel really guilty. They got home late. Their significant other's upset. The kids are upset. They didn't get to work the next day. The boss is upset. Or you really beat yourself up over excessive use of sugar. Or you went on an eating binge and you feel really, really bad. Huge similarity between food and other substances is relapse, right? Relapse happens all the time. All right, there's a great book if you've ever heard of Tenny McCarty. She wrote a book called Shades of Hope. She had a television program years ago called Addicted to Food, I think. It was what it was called. Great reality show that was real. It was real. It wasn't like over the top that people couldn't relate to it. It was very, very real. But here's what Tenny says. She says, if you can't take it or leave it, then you're probably addicted to it. And I agree with her. If you can't have just a few Oreos ever, or if you can't have just a few potato chips ever, like once you get started and you can't leave it, it's probably a problem. So I think that is a thing. So addiction, regardless of where it lands on the continuum, you need to find out, are there underlying issues? If you're an emotional eater, there's an underlying issue called not knowing how to deal with your emotions in healthy ways, right? If you're an emotional drinker, then I had to deal with that social insecurity or my own way deep insecurity and explore maybe where that came from. So there's therapy, there's support groups, and most importantly, and you're not going to learn this simply by having weight loss surgery. I say simply, it's not simple at all. I understand that. But you're not going to learn a critical skill for dealing with emotional or psychological or physical dependencies. And that's skills and tools. If you're an emotional eater, you don't need another diet. I've said that so many times. What you need are skills to prevent you from eating emotionally, which we talked about last time. You need a recovery plan. You need a way to prevent relapse from happening because relapse is so common. You give up sugar and then you kind of relapse, or you give up simple carbs and then you relapse, you go back to eating them. So having a plan to prevent that relapse is really important. Where do you learn this? In the process of getting ready for surgery. You don't. You have to go above and beyond, and this is on you to get the help that you need. So read that book called Food Junkies, second edition. um, Dr. Tarman, who wrote that book, believes that you have to be abstinent because you have to detox your brain, because sugar can really impact the brain very similarly as other drugs or substances of abuse and dependency. And then she says you can follow up with the education about the disease, the resources for how to stay abstinent, and then if you need it, get some therapy, she says. But here's some other really well-known professionals in the field of addiction and what they say. They say that addictions provide relief, and so many people who've experienced emotional eating will tell you that food provides relief from emotions they don't want to heal or they don't want to deal with. They want to heal, but they don't want to address those emotions, so they're eating. So in order to heal, you have to learn skills for dealing with those emotions. And that's by John Bradshaw, a physician in another Canadian named Gabor Mate, M-A-T-E, says the attempt to escape from pain is what creates more pain. So if you're eating to avoid the pain of emotions, well, then you get more pain because of the weight and the health problems associated with the weight. So the pain from the emotion results in eating. The eating results in more weight. So now you have another kind of pain. So another um, person says that when you address your eating problem, your emotional eating, your emotional dependency on food, then it brings your other issues to light and you can work on them. Keith Abloh says, confronting your pain, the emotional pain, it's not going to paralyze you. So many people are like, I'm afraid if I give up the food, I'm afraid of the emotions, I'm afraid of the feelings, I'm afraid of what I'm going to experience. It allows you to explore new parts of yourself. So by losing weight, you benefit, but you benefit more by finding yourself. And that is the real joy and the real healing that comes from weight loss or from dealing with food addiction. It's finding yourself and really developing that healthy relationship with yourself. And as you know, I've said so many times, when you develop a healthier relationship with yourself, you're going to have a healthier relationship with food because you're not going to need it to deaden the emotional pain that you have within yourself. So it's all connected. And then, of course, when you have a healthier relationship with yourself and with food, your relationships with other people are going to be easier and healthier. It's pretty complicated, but if you've got an issue with food, if you've got an emotional eating issue or an emotional a food addiction of any sort, you got to treat it in addition to having weight loss surgery. So that's what we have for today. Now, on Thursday, I'm going to go over a little quiz to help you determine if you think you have an addiction to food. So be sure to join me on Berry Aftercare. It's www.berryaftercare.com. You join that program, and there's a lot of benefits to that. So look it up and enjoy. And remember, as always, I say this is your health. It's your responsibility to do what you're going to do with it this day and every day. Ran a little long today, but this is an important topic, my friends. And I will see you and talk to you again on Thursday. Make it a good one. Take care and give this some deep thought. Bye-bye.